everyone. Thanks for tuning in to Connecting with our community. It's a great day here in Holt. I'm Melanie McNamara, Associate Broker with Keller Williams.
I'm Monica Harris, a local broadcaster here in mid-Michigan, and we're very, very pleased to be here with local dentist Dr. Susan Maples.
Hi, Dr. Susan.
Hello. It's so nice to be here with you.
Thank you so much for welcoming us. I know that you are a very busy lady. Dr. Susan is my personal dentist. I discovered her 2 years ago, and she welcomed me into the dental family here, and so I'm so excited to be talking to you today. One of the things I really appreciate about your practice here is you take a total approach to health, not just the teeth.
Total health dentistry is sort of the future of dentistry, so we're excited to be leading the charge for that in the entire country. And part of what I do is educate dentists and physicians throughout the country how to look in the mouth and use that as a diagnostic tool for metabolic illness, as well as taking a look at really how oral health and disease impacts the rest of the body.
That's amazing. So going to the dentist is not like it used to be when you just plop in a chair and they clean your teeth. I mean, now...
Well, I would say for most people it is, but it is for those people who are sort of jumping on board and adding layers of this, it is very helpful for everyone. And for physicians also, when we look at the medical community, they're pretty much overwhelmed with sickness right now. And it's typically a problem-focused exam where they'll get a pill for an ill, they'll go in for a short time. The average amount of time we're with our doctors in the United States now is 7 minutes.
Oh my gosh.
So we have more time, especially in the preventive arena, with the hygienist to really take a look at the whole big picture, help people really sort out what's going on for them, and set some health goals and help them move along that. Take a look at prediabetes and diabetes and acid reflux and sleep apnea and the multiple medications they're taking and food sensitivities, yeast infections, all kinds of different things that we can do to help.
That's fantastic.
Wow.
So you're really a leader in your industry of dentistry.
I am, and I didn't create this to be a leader. It just happened that we decided that we wanted to serve the patient of today and the future, and that patient is more complicated. And so we started maybe 15 or 18 years ago, and as this whole field has emerged, somehow, you know how God works, it's the right person at the right time, and I'm very blessed to be able to bring that forward.
You're also an author.
Yep.
Which I didn't know. That's
I have
exciting.
the book right here. I bought it a couple years ago. The Blabbermouth.
Blabbermouth 77 Secrets Only Your Mouth Can Tell You to Live a Healthier, Happier, Sexier Life.
Oh.
Who doesn't want that? I want all of that. So yes, I love it. I read it cover to cover a couple years ago, and I still just refer back to it every now and then. I know that you're published in dentistry journals and all over.
Lots of interesting things. Yes, we did an award-winning diabetes research study out of our office. We tested 500 of our patients with no history of diabetes to take a look at their diabetic status, and came up with a screening tool on paper or electronically that you can take to help you determine your risk factor.
That's fantastic.
Yeah, it turned out 20% of our patients were either diabetic and pre-diabetic and didn't know it.
Oh my gosh.
This year we tested a bunch of our patients for HPV, for the risk of oral cancer, and a third of the people who took the test were positive.
Wow.
Yep. It's been interesting for people to kind of open their eyes to some of these things. So.
Right. That's great. Now, what is this, forgive me, I don't have the name right, but the kit for the kids.
So the hands-on learning lab, we do hands-on
lab.
science experiments for every child with every visit, recognizing that childhood early caries or tooth decay is the #1 disease, but really right up with that is obesity. We're at Michigan's at about 37% obese, and childhood obesity is certainly on the rise. So we're really trying to affront childhood obesity, diabetes, tooth decay by doing hands-on science experiments with every child at every visit.
Fantastic.
What I'm most proud about with that is that by the time they graduate high school, they've had a full exposure to dentistry as a career by the science that they do. They've actually placed a sealant, they've looked under a microscope, they've screwed an implant into a model, and so we have like 39 practicing dentists that have come from.
Oh my gosh, are you serious?
I'm
39.
serious.
That's
And we have
amazing.
17 now in dental school. Isn't
amazing.
that crazy?
That's totally.
Fantastic.
I know,
Wow.
and it's my team's entire loving approach to
Mhm.
children, and a lot of, if you think about it, a lot of kids that don't have dental disease don't get any exposure to
Right.
what I do.
Mm-hmm.
So it's-
I'm floored.
Yeah,
That's
it's really
that's an amazing
you
number.
can look at it on our website. And
Yeah.
see.
Wow.
DrSusanMaples.com is the website.
And you have an event coming up.
Yes.
We do, yep. This weekend, we're gonna have this Love Your Heart event. I pulled together 6 speakers in the area. Actually, I did it with the Center for Optimal Health, which is Dr. David Possat, and now Dr. Alicia Williams, who's a preventive cardiologist, who's teamed up with them. And we're gonna actually be speaking for 1/2 hour each, and in between these segments, we'll be doing screening for A1C, carotid thickness of the intima, in other words, plaque layer in your vessels.
Mm-hmm.
A1C is diabetes screening. Periodontal screening, since that now is a proven way to get heart disease,
Mhm.
unfortunately.
Mm-hmm.
And high blood pressure, and we'll be doing a hands-on learning lab for kids on heart health.
Oh, that's
That's
great.
amazing.
So that's this
Yeah.
Saturday, the 12th.
At the University Club, 9
Okay.
to 3.
9 to
And I
3.
see Chris Johnson's going to be there. I
Chris
adore
Johnson
him.
speaking, isn't that great?
Yes,
He's a local
amazing.
celeb, and
Yeah.
he's doing it for us as a donation to our community,
Oh.
as well as the rest of the speakers. And
Wonderful.
Kurt Scholler, who's on meditation and stress, and Jill Marlin, who's a physical therapist, and so yeah, it's wonderful.
Wow.
So many great local
I was going to say,
people.
yeah. Wonderful
Well,
group.
Yeah. Well, thank you so much, Dr. Susan, for everything you do for our community. I know
Thank
you
you.
work with a lot of charitable causes and things like that, so we really appreciate that.
I love
Yes.
being part of this community,
Yes.
and to me, helping our whole community get healthier is what it's about.
Mm-hmm. I
Wonderful.
love it. I love it.
Yeah.
Well, thank you for letting Monica and I come
Yes.
in and chat with
You're
you.
welcome.
And thank you for joining us and connecting with our community. Until next time, thanks.
Thanks.